This video will demonstrate IV piggyback via line with peripheral IV fluid infusing. Verify MAR and healthcare providers' orders for medication.
I'm checking my physician's orders and looking at my MAR, and the medication to be given is gentamicin 80 milligrams IV piggyback.
Review allergies.
I have Diane Curtin's MAR, and it has NKA for allergies, which is no known allergies.
Research pertinent information about the medication. Class and action, dosage range, desired or therapeutic effects, adverse effects, nursing implications, pre-administration assessment such as last PRN dose, lab values, and vital signs, compatibility with primary IV fluid, and length of administration time. Gather necessary equipment and supplies.
Our equipment will be in the cupboards at the side of the room. I'm grabbing 2 secondary tubings and labels. My alcohol swabs and swab caps are on my WOW, along with a calculator and paper and pencil.
Introduce self, name and credentials.
Hi, I'm Mary Jo, the RN that's going to be taking care of you.
Perform hand hygiene and provide privacy.
I would pull the curtain.
Identify client times 2 identifiers and compare to MAR. Scan patient armband. Verify allergies with patient.
Could you state your name for me?
Diane Curtin,
Okay, and your birthday?
June 14th, 1941.
And do you have any allergies?
No, I do not.
All the information matches my MAR, and now I'll scan her band.
Apply clean gloves.
Gloves will be located at the head of the bed or on the side here.
Assess IV site for any signs of phlebitis or infiltration. Remove gloves, perform hand hygiene.
I'm noting at the insertion site that there's no infiltration, which would be swelling and coolness to the touch. There's no phlebitis, which would be warmth, tenderness, and redness at the site. I'm asking the patient if there's any discomfort. And I'll remove my gloves correctly, glove to glove, skin to skin. And wash my hands.
Select and scan correct IV piggyback medication. Verbally verify the 5 rights of medication administration. First check.
To get into my WOW, I put in the numbers 1, 2, 3, 4. And the drawer will pop open. First, I will scan my piggyback. Beep. And now I'm going to do the first check of the 5 rights. My patient is Diane Curtin. Drug ordered is gentamicin, and I have gentamicin. The amount is 80 milligrams. I have 80 milligrams. The route ordered is IV piggyback, and I have the medication in an IV piggyback. Frequency is every 12 hours due at 0800, and it is currently 0800.
Calculate correct infusion rate per agency policy, the pharmacist or medication reference manual. Both examples explain how to get to the correct milliliter per hour to run that IV piggyback. One example explains the formula method. One example explains dimensional analysis. The rate was calculated to be 100 milliliters per hour. Verbally verify the 5 rights of IV piggyback medication administration. Second check.
Second check of the 5 rights. My patient is Diane Curtin. The drug ordered is gentamicin, and I have gentamicin. The amount ordered is 80 milligrams. I have 80 milligrams. The route is IV piggyback. I have an IV piggyback solution. Frequency is every 12 hours. The time is 0800, and it is 0800.
Verbally verify the 5 rights of IV piggyback medication administration. Third check.
This is my third check. Patient is Diane Curtin. The drug ordered is gentamicin. I have gentamicin. The amount ordered is 80 milligrams. I have 80 milligrams. The route is IV piggyback. I have an IV piggyback solution. Frequency is every 12 hours, and the time ordered is 0800, and it is 0800.
Discuss the purpose of the medication, its action, possible adverse effect. Explain that you will give the medication through the patient's existing IV line. Allow the patient to ask questions. Encourage the patient to report any symptoms of discomfort at the site.
Ms. Curtin, I'm going to be hanging your IV piggyback, which is an antibiotic, through your existing line, so we will not need to poke you again. I will be running this through the IV. Do you have any questions?
No, I don't.
Okay.
Close the clamp on the IV piggyback tubing.
When you open your secondary tubing, the first thing you want to do is close the clamp. Otherwise, all the fluid will run out and you'll lose that medication and it won't be the correct dosage.
Connect the tubing to the IV piggyback bag.
Maintain sterility of the two connections.
Cleanse the primary IV fluid tubing injection port furthest from the patient or remove the swab cap if present.
If there is an orange swab cap at this port, you would just remove the swab cap. If there is not, you can take an alcohol swab, and you want to cleanse that port on the sides and the grooves and the top for 15 to 30 seconds depending on your hospital policy. Remember to choose the port that's above the Alaris pump so that the pump is actually regulating your medication infusion.
After attaching the IV piggyback tubing to the primary IV tubing, prime the piggyback tubing using aseptic technique. May also straight prime, however, do before attaching IV piggyback tubing. Do not lose medication while priming. Mary Jo will demonstrate back priming first and then demonstrate straight line priming. You can choose to straight line prime or back prime the IV piggyback.
I connected the tubing already, and this is a demonstration of back priming. The first thing you'll do is hold your secondary IV piggyback below your main line, and then you'll open the secondary clamp. The fluid from the main line, which is compatible with my secondary piggyback medication, will back prime in until the drip chamber is halfway full. If for some reason I overfilled the drip chamber, I can squeeze that into my secondary because I did check in the beginning and these two fluids are compatible. The other way to prime your secondary tubing, now I'm going to disconnect this to demonstrate straight prime, is you would open up your secondary tubing as I did before. And again, the first thing I'm going to do is close that clamp. I'm going to attach the tubing to my piggyback without contaminating the connections. I'm going to place the piggyback on my pole, and I'm going to squeeze that drip chamber till there is halfway full of fluid. And then I'm going to open the clamp and follow the fluid as it advances down the tubing, being careful not to lose any medication as it comes to the tip. Once I see a drip, I'll close the clamp. And then I'm going to cleanse my connection port. Again, per hospital protocol, for 15 to 30 seconds, and connect my tubing.
Lower primary IV fluid.
I'm lowering the primary fluid because the pump will infuse the bag that is the highest on the pole.
Program IV pump for secondary rate and volume to be infused, VTBI. Verify rate with your calculation. Open roller clamp on IV piggyback tubing and start infusion. Observe infusion flow. Observe IV site and patient for any adverse reactions or infiltration.
Okay, so I'm going to press channel select and secondary infusion. And then I'm going to look for the medication that I am ordered to hang. So I'm going to page down and I find gentamicin, and I'm verifying that is the piggyback that I have. And then it says, is it once a day or every 8 to 12 hours? I verify again with my MAR that it is every 12 hours. So I'm going to select the second choice. Then again, it asks, is it 80 milligrams per 100 ml or is it a different concentration? Mine is 80 milligrams in 100 ml, so I select that choice. Now it asks again, are you sure that it's 80 milligrams in 100 ml? And I'm checking my piggyback and my MAR, and that is the correct choice, so I'm going to hit yes. It goes through it one more time. The dose is 80 milligrams. The amount is 100 ml, and the dose is 80 milligrams. I hit next as a confirm. Again, it goes through another screen. Now the first thing it has at the top here is the rate is 100 ml per hour. And that is correct because I calculated in my previous step, and now I know that the pump has calculated it correctly. It's 100 ml per volume to be infused, and the duration is 1 hour. Everything is correct, and now I can hit start. I'm going to follow the secondary tubing and open that secondary clamp. And now I'm going to verify that my piggyback is infusing correctly. I'm noting that the drips are coming out of my secondary IV piggyback. The rate is 100 ml per hour. It's 80 milligrams secondary gentamicin. I'll then follow my tubing down to my patient, and I'm noting the site. There's no infiltration, and I do not observe any reaction by my patient.
Label IV piggyback tubing.
I would write my initials, date, and time, and apply it to the secondary tubing.
Reposition patient for comfort, call light within reach, leave patient in safe environment, and perform hand hygiene. Document IV piggyback administration on MAR, 6th right, and scan badge. For this checkoff, as the student is documenting the IV piggyback on the MAR, the instructor will reset the IV pump as if the IV piggyback has infused completely. Return to observe the patient following completion of the infusion. Close the roller clamp on the IV piggyback tubing. Return the primary IV fluid to its original position. Check IV pump to verify that the pump has reverted back to the primary rate.
When I walk back in the room, I'm going to verify that my IV piggyback is completely infused. We would simulate this bag is completely empty. So then the first thing I would do is close the secondary tubing clamp. I will raise my primary bag back up because remember I said I want the bag infusing to be the highest bag on the pole. And then I'm going to verify that it is running at 25 ml per hour, which is what my primary IV is ordered at. And the solution is 0.9 normal saline, and that is what is ordered on my MAR. I will follow the tubing again down to my patient's insertion site. Note if there's any infiltration, phlebitis, any reaction, and I do not note any of that.
Document completed IV piggyback infusion and scan badge. At the end of the procedure, the instructor will note that the student maintained proper body mechanics, maintained patient safety, and maintained sterility throughout and during the procedure.